So today we're going to do a full peripheral vascular assessment. So I'm going to start with inspecting and palpating the arms. And the other side. And check for temperature with the back of my hand here. So temperature is normal and even on both sides. Color of the skin is normal, there's no cyanosis. The arms are symmetrical, no obvious venous enlargement. So those are all normal findings. So next I'm going to inspect the nail bed. So I'm just going to check for color here. Normal color. And you press on the nail here for capillary refill. The color returned within 3 seconds, so that's a normal finding. Just going to inspect the other side now. So the nail bed is a normal pink color. And the cap refill test, the color returned within 3 seconds, so that's a normal finding as well. Next, I'm going to assess for clubbing. So if I could get you to put your fingers together like this. And like this. So the nail profile, that's good, thanks. The nail profile is normal, no signs of clubbing. So that's a normal finding. Okay, I'm going to palpate the upper limbs for pulses now. First, we'll start with the radial pulse. It's found on the lateral side of the forearm here. And a nice strong pulse there, amplitude of 2+. We'll check the other radial pulse. Same thing on that side, nice strong pulse, 2+, so those are normal findings. Next, I'm going to check the ulnar pulse. It's found on the medial side of the wrist here. And the other side here. So same with those, both those are a nice strong pulse of 2+. So next I will check the brachial pulse. It's found in the antecubital fossa up here. And the other side. And a nice strong pulse there as well with an amplitude of 2+, so those are normal findings. So next I'm going to palpate the epitrochlear lymph node. So I can get your arm there. And the other side. So both sides of the lymph nodes were normal. The size was normal. Consistency. Is there any tenderness there? No. So no tenderness. So those are all normal findings. So I'm going to proceed with palpating and inspecting the inguinal lymph nodes. So I'm going to do this over top of her shorts here. So they're found in the groin area there. Is there any tenderness there? No. Okay, so normal findings, they were size was normal, they're movable, consistency was normal, and no tenderness. So those are all normal findings. So we're going to move on to inspecting the lower limbs here. So if I could have you sit up on the side of the table here. Slide down this way. Perfect. So we're going to inspect the legs. Palpate the legs. Okay, so no lumps, bumps, or lesions. So normal color in the legs. I'm going to assess for temperature now. So feel the back of my hand again. So normal temperature, it's even in both legs. There's no lumps, bumps, or lesions. No obvious venous enlargement. So those are all normal. I'm going to test for edema now. So I'm going to press on the dorsal side of the foot, the shin, and behind the lateral malleolus. So no edema on that side, no pitting on that side, so those are normal. The shin. So normal turgor for the skin, it bounced back normally, so no signs of edema. That would be a score of 0 or 1+ on the grading scale for edema. So if I could get you to lay down now again, please, if you don't mind. So I'm going to feel the pulses in the lower limbs now. So we'll start with the femoral pulse. If I get you to flex this leg. Yeah, good, and spin down. I'm just feeling for the rectus femoris muscle there. So it's just medial to that and inferior to the inguinal ligament. So nice and strong there. Same thing on this side. Okay. Nice and strong, amplitude 2+ equal bilaterally. So next I will do the popliteal pulse. So it gets you to bend your knee, put your foot flat down like that. So I'm going to use both hands and feel with my index fingers deep inside, it's a little bit deeper, just above where the heads of the gastrocnemius meet. Okay, and the other leg, you can put this one down. Amplitude of 2+ on those as well, equal bilaterally. So those are normal findings. Next, I will assess the posterior tibial pulse. Found just posterior and superior to the medial malleolus. And the other side. So amplitude 2+ on those as well, so normal finding again. And the last pulse is the dorsalis pedis. So it's found on the dorsum side of the foot where the cuneiform bones are. So amplitude 2+ on those two. So next I'm going to assess the toenails and the nail bed. So I'm going to check for color, any cracking or dryness. So normal color, nice pink color. So we're going to do the capillary refill test now. So the color returned within 3 seconds, so those are normal findings again. So next I'm going to do the Homan's test. It's a test for deep vein thrombosis. So I will get you to dorsiflex your foot like that, and I'm going to lift it up here and just support it with my hand and squeeze the calf muscle there. Is there any pain? Nope. No tenderness?
Nope.
Okay, so that's a negative Homan's sign for the left leg, and same thing for this one, dorsiflexion. Any pain?
Nope.
Nope. So that's another negative Homan's sign or test for the right leg. So no indication of deep vein thrombosis. So next I'm going to do for skin color changes with positional changes. So I'm going to lift your leg up to your 60-degree angle here and hold it there for a minute. Just waiting for the leg to lose the pink color, have the blood drain out of the leg here. Okay, and if I could get you to dangle your feet over the side of the table there. Okay. Okay, perfect. So the leg went from a pale sort of color back to a nice pink color. Should take about 10 seconds there, which was roughly what I saw, so that's a normal finding. We'll do your right leg next. You can lay back down. And lift it up, please. Thank you. Okay, same with this one. I'll get you to turn and dangle your foot over the side quickly. So I'm checking for skin color change again there. Indicating artery and capillary refill and venous refill as well. So our skin color returned back to normal, so that's a normal finding. No cause for concern. Do you have any questions today? Nope. So that concludes the peripheral vascular assessment.